All right, hello everyone. I'm Joe Heinen. I'm going to be talking about COVID-19 comparisons across the world, especially looking at the United States. This is for BA513 at Western Kentucky University. So for the intro, late 2019, a previously unidentified coronavirus emerged from China and expanded globally in the next few months. Obviously, everyone around the world pretty much knows about this if they have any access to like news, internet, TV, things like that. Early on, the person-to-person transmission was not exactly known, so the main vehicle obviously was unknown. So people were using like hand sanitizer, wearing masks, not going outside. Healthcare professionals were worried just because they didn't know the transmission type. On 11 March 2020, the World Health Organization declared it a pandemic, and then soon after, mid-March area, the states in the United States declared stay-at-home orders. I think like 47 out of the 50 states declared those stay-at-home orders, and then the pandemic kind of officially started in the U.S. Obviously, the research continued throughout the entire pandemic, and that included kind of like an open ear process to the public about what the scientific community was learning about, and that kind of created a weird, like, it started with like the politics and then just people like what they personally thought about the virus, and it kind of changed the direction of how COVID-19 was interpreted from the public. And I think that's pretty much everything I had. The general public is faced with ever-longing changes as the direction fixes to COVID-19. And then the end of May around there had kind of the mass reopening. Not every state's the same, but bars, restaurants, people are slowly starting to go back to work. Previously, at the beginning, it was like that mid-March area. It was just like essential workers they were deemed, and going like grocery store workers and like shipments, things like that. That were really the only people going to work. But it's slowly gone back to at least halfway normal, depending on what state you're in. So question number one was, how does total cases per million compare to the US only versus the entire world? So at the top here we can see cases per deaths per million. This is for the entire world. It's just about 50 for deaths. And then here, oh, I guess we can hover over it, 45, and then for the US it's 176. So it's higher in the US for deaths per million, and then this is 1251 cases per million and 3901 here. So obviously both of those areas are about tripled, so the U.S. Is worse in that category for cases and deaths amounting towards the through the whole pandemic. Moving on to the new cases, so this is the recent cases. This should be the same numbers about, yep, 0.54 and 2.19, so about quadruple for the new cases. So U.S. is doing worse as of late for the deaths per million, and then 19 and 3, so that's over 3 times as well. So the new cases, the U.S. is spiraling in a downward trend according to the rest of the U.S. or according to the rest of the world. So now looking at total cases versus total population. So I think this is a helpful statistic and just data in general, because we can see how much of the total cases of COVID-19 in general across the globe is that country, and then how much that country is actual population. So as we can see, the big one, we'll just start from littlest to biggest. So Asia is over half the world's population. This is obviously based on continents, but only about a quarter based on the pie chart for total cases. So they are looking really good there. And then we'll move on to Africa, where they're doing pretty well as well. They're obviously more poverty stricken, so they might not be reporting as high numbers as well, but they do have not as much population density as well. Moving on to South America, they're not doing too great. Their total population is very small according to the rest of the world, but their total cases is pretty high. And then North America and Europe, about the same story there. They're both about a quarter. North America is a little bigger there, but we can see that they're about the same pie shape. So obviously, Asia looks like they're doing really well with total population versus total cases, and then North America, Europe, and South America not doing too great. All right, so over here was a pretty difficult statistic that I wasn't able to read in the greatest format. So I kind of worked with this one. Hopefully, you'll be able to understand and pull from it what I tried to pull out of it. So the question for it, does population density have any effect on the number of cases? So as we can see on the right side, I picked notable countries, just countries that we've either heard about with COVID-19, that they've been popular or not, if they've been doing well or not. And then these are just the top 20 cases per million. So these are pretty much the worst, the countries that have the worst numbers for cases per million. So you have Senegal way up here, and obviously it pushes to the left for population density. And then the smaller population per density, but the less cases per billion. So they both have pretty much the same structure of this route working down to the bottom right. And as we can see on the US and Spain is pretty high up there. And then Netherlands, India is looking pretty good down at the bottom right. So moving on to the question 5, how does poverty affect the cases in continents? So obviously this is just continents again. We can see that the extreme poverty, the left side is less extreme poverty in the nation. Africa is far to the right and high, which that is bad in both cases, since it means that they have a lot of cases per million and they have a high poverty level. But on the left side, we can see all these continents are about the same poverty level, and it's just the levels. I was actually surprised that North America wasn't higher in this list, but obviously I've never been to any other countries and I'm not totally versed on the poverty levels. But this is one that North America doesn't actually look too bad in. So then the last one, I think this was just a good representation for how, or I guess I'll just read the question. Across the world, where does the United States stand in deaths per million people? So I thought the US was like 100% the worst country for sure for deaths per million. However, this portrays it in a little different style. So we can see that Belgium, Andorra, Spain, Italy, United Kingdom, France, Sweden, Netherlands all beat out the United States. So that is 9 countries, or 9 like population areas that are better, or that are worse for deaths per million with the United States. So just because we are looking at the average, looking back at this, the cases death per million versus the U.S. cases death per million, it makes the U.S. look pretty bad, and I thought it'd be the worst. But then looking here, we're not the worst with the deaths per million. So obviously not in a great position. However, not doing the worst, that's for sure. Moving on, actually, nope, nothing else on that one. So moving on to the future of COVID-19. Obviously with this data, we can see that the U.S. needs to do a lot of work to push towards the better half of COVID-19 compared to other people. Obviously, in a perfect world, this would just be totally done. Everyone would have no cases. However, that's not exactly the case. So it's kind of the battle of who can do the best for their country and make their country the best that it can be in this time. So the future of it is mini waves every few months. So like there's 3 possible scenarios that I read about that I have in the source at the end of the slides. There's going to be a mini wave every few months, there's going to be a massive second wave, and then there's going to be continuous outbreaks for a few years. So that could be pretty interesting to see how that could affect all the data and things like that. It could be a long stretch of data, and obviously the hospitals and the healthcare professionals will learn more about it as well. The fragile communities cannot cope as well as others. This has been really heavily reported in the last month or two by just the general news cycle, and it's obviously true. Like the people of color and the Hispanic communities are being hit a lot harder in at least the U.S. I don't know exactly the global numbers, but I think that'd be an interesting way. Obviously, election season's coming around. I don't know how much of effect this will have, but just Yeah, not too much on that. I don't know the exact specifics, but I think it should be interesting to see if that comes up in the debates or anything as well for the United States. The 2020 school year is just beginning. It's 12th of August right now, and I think Georgia and South Carolina has opened up their schools, and I don't know if masks are mandatory or not, but so I guess I'd never talked about that. The CDC has pretty much finalized that it is aerosols that is the biggest issue with COVID-19. So masks do seem to be the answer to the problem in this pandemic, at least in the U.S., with people being so close quartered. And with obviously school, that's pushing people together. And if we could get some masks on people, it hopefully would look a lot better. And then pandemic complacency. I think this has hit a lot of people, whether it's the healthcare professionals, just general workers, wherever you're working, and in people's personal lives. People are getting sick of it. People aren't looking to socially distance, wear masks, all those types of things, as much as they were at the beginning. So I think that's not good. However, if we don't see numbers keep spiking and we can slowly see the numbers go down, or the scientists can learn more about the disease, then that would be obviously good. And then lastly, I think a toss-up is overwhelmed hospitals. We saw this a little at the beginning of the pandemic back in March and April, that hospitals couldn't contain all these people in there. Actually, they had like hospitals in the park set up and everything. But that could be an interesting thing in the second scenario where there is a massive second wave. But if it's just a continuous outbreak for the next few years, it could then turn into like a flu-like situation where we know it's coming. Maybe it comes with the weather, things like that. I'm not a scientist. I don't really know. But that's something that could be interesting on economic level, healthcare level, government level, all those types of things. And then lastly, lessons learned for this project. So obviously we had to pull all the data out ourselves, kind of. We were given just like a broad way to go and kind of figure it out on your own, which is really interesting, and it showed that data is everything, and it's pretty difficult to find good data for what you want. So I pushed in to the project thinking that I wanted to do something about unemployment, see if what like the dates had for like at the beginning, how was unemployment towards the end, even with higher numbers, since it has been pretty stagnant for like the death rate, but not the cases. But I couldn't really find good data on that, so I had to pivot with when I finally found some really good data, how can I pull some interesting things from this? And I think if I was in like a commute or like a business standpoint, it'd be pretty difficult to find really good data, but maybe you'd have like a data department or something like that that would get that data for you. I'll work for a breakthrough. So I worked for about 4 or 5 hours on just trying to find something that I could work with. And then right when I found that thing that I could work with, I like was able to just whip out all this stuff, watch some more tutorials to figure out like the scatter plots, just redoing all that stuff because we've done so much stuff just in these 4 weeks that I kind of blew by it, forgot all about it and how to exactly do it. But yeah, it was pretty cool to actually, like 80 to 90% of the stuff I could do just from my memory, so that felt pretty good. And then don't overcomplicate your situation. Just make sure that you figure out what you're doing and then just do it. Don't try and dive deeper unless you really want to, or if you have a lot of time, or if it's just like a project of passion or something like that. And then the new ideas, so I think it'd be really cool to get a time-based data, so like rates or deaths every 2 weeks versus months, and then see what the effect is in like mid-March, what it was in mid-April, in mid-June, July, obviously, etc. And moving on like that, I think that'd be really cool. And then like I've talked about a few times, community and ethnicity data, I think that would obviously be good. We see like those general statistics in the news, like 61% are Hispanics are more likely to die of COVID-19, but I would like to see it just a little more data on that for sure. And then age groups I think would be really interesting as well. I think you could do a whole project just on age groups. So that's all I got. Pretty much talked about everything that I wanted to there. These are my sources. ourworldanddata.org was huge for my Excel sheet and my data source of what I was pulling from. And then everything else was just information for all like the future of COVID-19 or intro slides. Thank you, Professor, for all the help with the emails because it really helped a lot getting those fast responses. And that is all I got. Thanks for listening.